Why is our health informatics program unique? Well, we're about application. We really look at the interoperability piece. We're not what might be called an informatics light. We don't look at things from a superficial level. We look at things from an information systems level. Students are required to take a class in databases as well as understanding data communication. So it does have a technological orientation. We do have an implementation expertise as well as a focus on project management, process analysis, and ultimately the business analysis and the meaningful use piece of health informatics. There are other programs across the country offered online that have less of a technological orientation, deal with technology at a higher level and have more of a clinical focus. That's fine, and there's certainly product space for them. But if you want to be involved in health informatics, it's our belief that you have to understand the technology. People with a clinical background do very well in our program. We, to this point, to our knowledge, have not had a student drop out of the program. And we do a lot of work on a team basis. So what we find is a lot of peer education. So there's, if you don't have a technology background right now, it's okay. What we are is like an MBA program if you don't have a background in business. You take a class that is essentially the undergraduate business program that is on steroids, that's accelerated. So you do not have to have a technology background to be admitted into the program. What you do need is an interest in technology. So I hope I made that clear, and if I didn't, please ask a question about it. Our program is very applied. You can look on our website, or I should have a link here to show you who our advisory board is. It's an advisory board of virtually every chief information officer in the greater Cincinnati region, St. Elizabeth, Mercy, Children's, Tri-Health. I don't want to leave anybody else. Christ. We also have the chief information officer from Norton Healthcare in Louisville, the CIO from St. Clair, and once they have a permanent position, we'll have the CIO from Pikeville on our board. We have a chief informatics officer from Children's on board. We also have a chief informatics officer from Baptist on board. We have the Lieutenant Governor, Daniel Mangiardo, who's a physician and who's very interested in e-health as one of his core areas. Chief Nursing Officer from the VA. I can go on and on, but we have a very good advisory board. On a biotech startup, we have the Chief of Business Development. So we listen to our advisory board. Our advisory board tells us what students need to know. And we have, in an evolving field, we have an evolving curriculum. We have an experienced faculty, a faculty that have a background not just in the academics but in the business world, and we're very proud of that. We also make use of adjunct faculty. One CIO, for example, teaches one of our technology sections. We also have a VP of Finance teaching the business of healthcare. So we have people in the industry. We have great community engagement. We have guest lecturers. We use our advisory board and their staff as guest lecturers in our program.